My name is Anna Matonti, and I came this country in America, in New York, 1955. Then we moved from New York, we came to New Mexico in 1969.
My name is Giuseppe Matonti. I came to the United States in 1956. I came to New Mexico in 1969. In Daniel, we bought 1 acre of land. And when we saw the land, we fell in love with the weather. Because it was 100 degrees in the shade and nothing happened. We don't sweat and nothing. In New York, with 85 degrees, it's like somebody throws water at you.
My name is Rosa Matonti, and I am the daughter for Joe and Anna. They've been married for over 50 years. My mother was pretty much an active woman until her 70s. She had a bad back and so required the implantation of a morphine pump. About 9 years ago, she had to have it refilled, and at that time it was not accessed properly. That began kind of a downward spiral in her health. So for the first year, post-discharge, she was probably in the hospital about 11 out of the 12 months. About 3 years into Mom being sick, she requested that we no longer take her to the hospital. She was ready to stop, and to stop all extraneous measures for her care. She no longer wanted to go to a hospital. She no longer wanted that type of care. We had the home health care, the Presbyterian home health care that the nurses were coming in. And one of the nurses had suggested hospital at home and said, maybe we can get these folks to come in and see your mother and take care of your mother. And that way they can do an assessment while she's in her bed, and they can really check and see if she's doing well. And that became our starting point with hospital at home and the wonderful journey that they have provided for my mother and for our family, and the support they've rendered to us.
My name is Melanie Van Amsterdam. I've been a physician for 17 years. The first time I met Anna and Joe and the Matontis, it was for a hospital at home admission. And Mrs. Matonti was so sick. I really didn't think she was going to make it. But we treated her. I think it was probably a pneumonia that first time. And she came through it like a champ. I think the care is just so much better when the patients are in their home. It's a familiar environment, a safe environment for them. All our data has shown that people fall less, they die less frequently, they have less undesirable outcomes like infections that are acquired, like they would be in a hospital. So our safety and our outcome ratings are through the roof. I really need to say that working with families like the Matontis has been the best part of this, without a doubt, because you really get to know your patients and develop a relationship with them that you can't in a 15-minute office visit. And so that's been enriching for me.
We started with hospital home after she was out of the hospital, probably by second to third year. So we've had these extra 6 years because of the hospital at home program. My mother says it all the time. I thank God for the doctors at hospital at home, because they made it so that I can live the rest of my days here with my family. She will not go back to a hospital. She's told us that. And she's healthy, and she's happy, and we're happy as a family. And I know that my father's happy because he has the woman he loves with him. I don't know how happy he would be all alone, right? You get to a point in your life where you can't be without the person you've been with more years than you were alone.
We cook something. I told him what to do, and we managed it.
But she told me what to do. Otherwise, I don't know. I never done it before. When before my wife got sick, I couldn't even boil an egg.